You're listening to the station that serves your community. AM 1240 WGBB.com and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You are listening to Healthy Living Radio, dedicated to bringing you the latest advances in health and wellness so you can live better, healthier, and longer. Today's topic, how small changes in your smile can make a big difference. Our guest on tonight's show is Long Island's go-to dentist for cosmetic dentistry, Dr. John McLoughlin. John, thanks for being here tonight. Appreciate you being on the show.
Thanks for having me. Appreciate it.
So let's just tell our audience before we get started a little bit where you grew up, where you went to dental school, a little bit of your background.
Sure. I went to Georgetown Dental School in Washington, D.C. I was born and raised in Bayshore, New York, which is where I practice now. Very, flattered to be practicing in the area that I grew up.
Did you always know you wanted to come back to Bayshore
I did.
Practice?
I did, absolutely. I remember when I got out of dental school, my friends were asking me where I would set up my practice. And they were surprised with the traffic and, at the time, local prices and the cost of living. They were actually surprised that I came back. But it's such a great area to raise a family, such a great community. So I'm really, really happy to be back in the area.
It's got to be nice to have people who you grew up with, even, people who are maybe teachers or people that knew you when you were a kid. Now they come to you and you're their dentist.
Absolutely. Yeah, they're teachers, principals, physicians, all kinds of different people that I've known along the way. And, again, very flattering that they come to the office. Great to see them.
Yeah, that's exciting. So I want to talk about cosmetic dentistry tonight, or aesthetic dentistry. And, let's just tell our listeners a little bit, really, what is that? You hear people saying they want to have a smile makeover. You see those shows all the time. What is cosmetic dentistry? What is a smile makeover?
It actually can encompass a lot of different things. Anywhere from tooth whitening to porcelain veneers, aesthetic crowns, non-metallic crowns, a lot of different things. We actually incorporate Invisalign, which is a type of orthodontics where you don't have to have metal wires and brackets. So it really runs the gamut. It can even just entail, fixing a small chip on a tooth.
How long have you been practicing?
22 years.
So what kind of changes have you seen in cosmetic dentistry over that time?
Well, I think technology has entered the field. I think we're fortunate in the sense that there are a lot of different, technological advances that have been made. Anesthetics are a little bit more powerful. I see that we can rely on the computer. We can rely on digital imaging. A lot of different techniques and a lot of different technologies that have really entered into the field.
I think you and I graduated dental school at around the same time, and I remember being in dental school, and there was even no talk about cosmetic dentistry then. It was just, bonding was just beginning.
Right.
Was it the same way for you?
It was, and as a matter of fact, I remember being in dental school, and I had a patient. I had done a lot of reading on porcelain veneers. Had a patient that I thought would benefit from porcelain veneers, and my instructor told me that was not part of our curriculum. However, he did allow me to do the porcelain veneers on this patient, and I just remember the feeling that patient had when the case was finished, and it was tremendously rewarding.
What were their teeth like before?
They were in need of repair. That patient was just never happy with their appearance. They were dark. There were some cracks. They were out of position, and that patient was always conscious of that. So I think they had developed a habit of kind of covering the mouth with their hand when they would smile. Really just a tremendous improvement in their confidence after the case was finished.
So tell our listeners, because not everybody knows, really what is a porcelain veneer? And before that technology came along, how would somebody with a smile like that patient you just mentioned, how would they have been treated, if at all?
Oh, that's a good point, because often they were not treated. And if they were, it would be with cosmetic bonding. Which, when you're using it, for multiple teeth or for an entire tooth, there are some shortcomings. The bonding has a tendency to darken quickly. It's not as strong as porcelain. Porcelain actually is more lifelike. The light shines through the porcelain and makes the tooth look more natural. So back in those days, really the only thing that we could do is put on a kind of a putty material, which was the bonding. Mm-hmm. Now we have the porcelain veneers, and we're able to treat the entire tooth and multiple teeth, and even the entire smile. and in most cases in 2 visits.
Now, do you have to grind down the teeth for a porcelain veneer? What exactly is it?
Not necessarily. If you almost think of kind of a fake fingernail, you wouldn't grind down a fingernail in order to put the fake fingernail on. But in some instances, if the teeth are protruding and you were to put a porcelain laminate in place, it would make it protrude even further. So in those cases, we would trim the tooth back a bit and then go ahead and bond the porcelain to it. In many instances, we don't have to adjust the tooth at all. We can go ahead and bond the porcelain to the tooth itself and get a great result.
So really, what's the difference between that and a cap or a crown on a tooth?
Well, a crown necessitates grinding the tooth down to a stump, to put it bluntly. And the porcelain veneer is much more conservative. It's really only a facing on the outside of the tooth. And with some of the strong bonding materials that we use now, we're able to bond just that outer covering into place and get a very strong result.
So almost like a laminate countertop. It's just the outermost layer on top of whatever's underneath.
Very similar. And along the lines of that, if you were to take that laminate before it was bonded, it's pretty easy to break. Same thing with the porcelain. But once it's bonded to the tooth, it's actually very strong.
In preparing for the show and looking for guests, we always try to look for the people that are leaders in their area, and your name really kept coming up for cosmetic dentistry in your area. So tell me, who's your typical patient that comes in for cosmetic dentistry?
It really runs the gamut. We've had, patients that really are across the board. I think when you think of cosmetic patients, you would think of, higher income patients. You would think of, patients that maybe are in the movie industry or have some sort of high profile occupation. But in reality, it's really a cross section of society. There's a lot of blue collar. There are firemen, teachers, professionals. It really runs the gamut.
It's funny that you say that, because you would think that. Just like you said, people have in their minds sometimes that cosmetic dentistry or doing something like that is frivolous or it's, wasteful, especially in these times. But, you're saying it's just sort of the average person, the school teacher, the fireman that comes in for this kind of stuff.
Absolutely. And I think that people are always looking to improve themselves. I think people, can become self-conscious about, peculiarities. And the smile is something that's very important. I had a patient that came in the other day and had recently lost his job and had is trying to re-enter the job market and having some difficulty doing that. And he felt that maybe his smile was holding him back to some extent. So he felt it was important, to go ahead and take care of the things that were bothering him and really kind of complimenting his or compromising his confidence. So he came in and he was looking to have some of those shortcomings taken care of, and he was very happy with the result, and he felt a lot more confident going back out into the job market, interviewing and so forth. So, even cases like that, I think, are important.
Yeah, it's funny. You almost can't. It sounds corny, but you almost can't put a price on how you feel about yourself. If someone smiles and they have a gap or they're embarrassed about it, they probably won't even talk to a spouse and say, hey, I'm embarrassed about this. None of us like to admit what we're embarrassed about. But how do people typically feel? What do they typically say when they've had this thing that's been bugging them for 30 years or 20 years or however long, and they finally take care of it? What kind of things do they say to you?
It's amazing to see, the transformation. They're very, very grateful. I think what I hear most often is, why did I wait so long? We have patients.
Why do you think people wait so long?
I think it has to do with a couple of different things. I think, sometimes cost is something that holds people back. But, the vast majority of patients that we've treated have actually been surprised at how inexpensive and affordable the treatment can be depending on what they do. We offer interest-free financing. And a lot of patients, when they look at the monthly payment as opposed to the lump sum that they would be paying for the treatment and find out how affordable it is, a lot of patients would go forward at that point and be very happy that they did.
It's when you say about the cost, it's probably more the fear of the cost than the actual cost. They probably have a number in their mind that what they think it's going to be. They think it's unaffordable, but they never really check it out.
Absolutely, and we see that a lot. A lot of patients come in and once they come in, they sit down with us. We go through the specifics of what they're interested in doing, and we break down the cost for them. Especially when we break it over, monthly payments with interest-free financing. They're very surprised at how inexpensive the treatment is.
When you look sometimes what you pay for your cable bill every month, and for people who smoke or a couple meals out in a month, it really adds up pretty quickly. And I would guess you could get a lot of cosmetic dentistry done for the same cost.
Absolutely. So.
Do excuse me. So when people come in and they're going to have cosmetic dentistry, what's their mindset like? Do they come in? Are they embarrassed? Do you ever find that that's a hurdle? Maybe that they're ashamed that they let it get to that point. Do you think that keeps people away?
Yeah, I think so. We have seen that really. A lot of times, really, the hardest thing to do is to come in for the initial consultation. Once we sit down and we show them what we're able to do, we have before and after photos. We have actually an iPad that will show patients what can be done. I think that's the toughest thing is actually to take that first step and come into the office.
We're going to take a fast break. You're listening to Healthy Living Radio. I'm Dr. David Scharf.
This is Healthy Living Radio with Dr. David Scharf.
We're back. We're talking with Dr. John McLoughlin, dentist practicing in Bayshore, New York, our local expert on cosmetic dentistry. And before the break, we just started to talk about how people feel maybe coming in before cosmetic dentistry. So, I would think if I were having something like that, I'd maybe be nervous that I would spend all this money, I'd spend all this time, and when the case is finally done, I'd hate the way it looks. Sometimes you turn on the TV and you see these news people and the teeth look terrible, and you think, boy, how did they do that? So if I'm thinking of doing this, how do I know before I start that I'm going to like what I look like, or can I get a sense of what it's going to be?
Well, we were talking about technology earlier in the program, and I think that ties into that a bit. We have something called Smile Pics, where we're able to take a photo of the patient's smile, and then we can digitally enhance it to show the patient what the result may look like. And in essence, the patient gets a sneak peek at how the finished product would look. And in some instances, the patient will want to make some changes. We can make some alterations, and it's much easier to do it digitally than after the case is placed. I had a patient that came in, it was sometime in the spring, and again, had been interested in doing something for quite a while, but never really took the step to come into the office. And after we went through the Smile Pics and we showed the before and afters, that was the impetus to go ahead and have the treatment done. I think it was really what was holding him back to that point was really the uncertainty of what he would look like. And I see that with gentlemen more so than ladies, is that they they don't want to come across as being vain. Mm-hmm. They don't necessarily want people to know that they had something done. And cosmetics is kind of in the eye of the beholder. It can be something that's very white and large and obvious. And cosmetic dentistry can also be just restoring what nature meant for the patient to have. And I see that with a lot of the gentlemen that we see in our office. We're able to give them a nice natural smile, and they can see that beforehand with the Smile Pics.
Sounds like the goal is that when they leave, that their friends say to them, "Hey, you look great. Have you been working out? Did you lose a couple pounds?" Versus, "Wow, you finally got those ratty teeth fixed." Absolutely.
Yeah, patients in my office, we have flat screen TVs, and patients will come in and watch the different daytime programs as we're going along. And Regis Philbin happens to be on periodically in the mornings, and he's got kind of one of those dramatic Hollywood white smiles. And there are a lot of patients that aren't specifically looking for that, but
they are or they aren't.
They're not. They're looking more to have.
They don't ask for the Regis.
They don't ask for the Regis. Absolutely.
Before the show today, you were telling me a great story about a patient whose son broke his teeth upstate, and I want you to tell our listeners that story because it really talks to the point of how the nicest thing is the most natural, not necessarily what the current media is making as the nicest.
Right. And I think that's something that we do with our patients as well, is that we take time to talk to them. We take time to find out what their expectations are. And this particular college student was upstate, several hours away, and I got a call. It was late in the day. We were about to leave, and the patient's mom called and told me that he had fallen. He had broken two of his front teeth pretty severely, and that he had seen a dentist upstate. And that he was had done something temporary, but that she wanted to come into the office, to come into my office and have me take care of him because I had seen him pretty much his whole life. So we saw him a couple of days later. We got to him as soon as we could, and when we sat down and we talked about the result that we would come up with, I told her that there were some discrepancies in the teeth that were existing, and that we could certainly improve the situation and make them perfect and ideal. That was something that she did not want. And I was glad that we had the conversation because what she was looking to do is to restore them to the way that they were before he fell. Both teeth were a little bit turned. They were slightly out of position, and they had some discolorations in them at all. So we endeavored to return him to exactly the way he was before, imperfections and all.
And how did she communicate that to you? With pictures or just from your knowledge of having seen him?
Right. We had some models that we had previously, so we went back to those. And we also, spoke to her in specifics as far as how the teeth looked before. And we saw some photographs.
So what did the mom say when you were all done with fixing his teeth?
She actually, she said to me, "I have my boy back."
That's
very,
nice.
very rewarding.
And her son said, "Ma, don't call me boy. I'm not your boy anymore."
Exactly. So
how do people, if someone's coming in and they just know that they don't like their smile, do people bring in magazine pictures? Do they bring in their spouse? How do you go about getting from point A to point B?
Well, again, it really comes down to communication. And the more information that the patient can bring to us, the more of a chance that we have of delivering what they're expecting. Some patients will come in with celebrity photographs, again, Regis Philbin and so on and so forth, and then, ask us to model, the type of smile that we see in the photograph. And then other times patients come in and they really don't know what they're looking for. They know that they're unhappy and they want to improve it. And in some instances, what we'll do in that case is that we will use some of the bonding that we talked about as a temporary, and to give them an idea before we do anything of what the smile may look like. We can mold the bonding, we can shape it, we can change the color, change the length, and so forth. And in that way, patients get a profile ahead of time of what we're going to do as well.
You know what you've mentioned a couple of times, which sounds pretty unique in dentistry and certainly in medicine, is actually just taking the time to talk to your patient and understand what it is that they want. And I mean, it sounds like of all the areas of dentistry, doing cosmetic dentistry, finding someone who's going to spend the time and talk to you is probably as important as someone who can do the work properly.
Absolutely, and we find that that's extremely important. We want to know ahead of time what the patient's looking for, so that we can deliver it. And I think it's extremely important to take the time, speak to the patient, find out what their concerns are. If you rush into these cases and you're delivering what the patient didn't want in the first place, it's disappointing for everybody involved. So we try to avoid that.
Do you ever get people whose expectations, you just know there's no way that you can meet their expectation when you're just starting to talk to them?
I do oftentimes have that initial feeling, but again, when we go through the smile pics, or when we go through, the bonding, the mock-up with the bonding, now we're starting to actually dial in whether we can deliver or not. And there are very few cases where we're not able to deliver what the patient is looking for.
Is that right?
Yeah,
that's great.
Yeah.
That's great. You mentioned before Invisalign, so I know that that's a new technology, and you've had a lot of training in that area. So let's just talk about that a little bit. What is Invisalign?
Invisalign it's an orthodontic technique. Instead of using wires and metal brackets to straighten teeth, we use a series of clear plastic aligners. Each aligner will move the teeth a little bit, and then when that movement is completed, we put the next in the series of aligners in until you get to the last aligner and the teeth are straight. So it's really a kind of a cosmetic way of doing the orthodontics without actually having to have the metal brackets and wires and so forth.
So who's your typical Invisalign patient?
I've had, kids that are, high school age, middle school age, and I also have patients that are seniors. I have several patients that we've treated that are in their 60s, and I remember the first one that came in. She was 68 years old.
Is that right?
Came in, said, "I want to do Invisalign," and said, my dentist does not offer it. Mm-hmm. And then she stopped and kind of looked at me sheepishly and said, "Am I too old?" And I said, if this is something that you want to do, you're healthy. And it was certainly indicated in her case. So we went ahead and did it for her, and she was ecstatic when the case was finished. So it really Invisalign is something that can be appropriate for a lot of different age groups.
Now, is she someone? Did you talk to her? Is she someone that had her whole life her crooked teeth had bothered her, or did they get crooked later in life?
Yeah, she actually. This is something that she told me that from the time of her being a young adult, she had always been conscious of it. And again, one of those situations where she would hide her smile, she would put her hand up. Never liked to see herself in a full blown smile in pictures. And she's been a patient now for several years, and she really remarks periodically on how it's really changed her confidence level. She's really able to smile now. She likes seeing herself in pictures, actually.
That's great. We're going to take a short break. I'm Dr. David Scharf. You're listening to Healthy Living Radio.
You're listening to Healthy Living Radio with Dr. David Scharf.
All right, we're back with Dr. John McLoughlin. You're listening to Healthy Living Radio. So you just mentioned the woman in her 60s who had the Invisalign. How long do Invisalign cases typically take?
They can take as little as 6 months. Some actually shorter. I've done several cases where they were completed in 4 months.
Really?
Yeah, it depends on the amount of movement that's necessary. And then there are cases that will go on for 2 years, depending on the amount of movement that's necessary in the case.
And do people wear those aligners all the time?
We recommend that they wear them. The more they wear them, the quicker the teeth will move. So we recommend that they wear them 24 hours a day, 7 days a week. Take them out to eat, brush your teeth, put them back in. Which is really another advantage of the Invisalign. When you have traditional orthodontics and you have bonded brackets, bonded metal brackets, bonded wires, those are not able to be removed. So when the patient is cleaning their teeth, they have to kind of clean around these wires and brackets. With the Invisalign, however, you're able to take the appliance out. You're able to take them out, and you're able to brush and floss and thoroughly clean the teeth. So from a hygienic standpoint, it's actually an advantage of doing the Invisalign.
What are the most common questions or concerns people have that are coming to you for an Invisalign consultation? What are some of the biggest concerns they have beforehand?
I think the main concern usually is that my teeth used to be straight. I never wore my retainers, and now they're crooked again. So, that seems to be the profile. And the great thing about that is that we know that they were straight at one point, so we know that they'll go back to being straight. And again, those cases are usually fairly quick. Cases inside of a year. And I have patients that will come in and also where there's maybe a minor situation. Maybe there's one tooth that's out of position, and they said that in order to move that tooth, the dentist was recommending having full orthodontics placed. Bonded brackets, metal wires, things of that nature.
I would guess most adults don't want to do that, don't want to have the braces back on.
Absolutely.
So can people go to work with these, and can the coworkers see them? Can they talk on the phone? Can you function with those okay?
Absolutely. As a matter of fact, I've treated several of my staff in the office, and I've had patients, tell me that they're afraid that we're going to be able to see the Invisalign as they're being worn. And in reality, they had been with one of the staff members for the last half hour and didn't notice that they were wearing them.
Is that right?
Yeah. It's really it's really low profile. It's really something that's not easily detectable.
So. A common question that we get from our listeners who are thinking about having cosmetic dentistry, who don't know where to start. They've been away from dentistry for 10 or 15 or 20 years, which you say is a kind of a common thing. You see that commonly. How should someone go about choosing a cosmetic dentist? How do they know they're in the right place?
Well, I think that again, it comes down to communication. I think if you are if your dentist is willing to spend time, willing to go through what your expectations are and your different options, I think that's important also, because there really is no one size fits all. It's not that porcelain veneers are right for everybody, or that Invisalign is right for everybody, or cosmetic bonding is right for everybody. There may actually be some components of each one of those things that may be involved in any particular case. But I think the important thing is to find a dentist that's willing to take time to really discuss with you what your options are.
Do you get patients who someone else is their dentist, but they just come to you for the cosmetic dentistry because of your reputation?
All the time.
Yeah.
All the time, right? And we're happy to help. And we certainly are willing to take whatever role the patient is interested in. If they want us just to be the treating cosmetic dentist, we're more than happy to do that. And, we welcome them returning to their general dentist to continue the cleanings and small fillings, things of that nature. Mm-hmm. But we routinely see that when patients come in for their cosmetic treatment, that they like the office, they like the results, and they like the staff, and they're willing to stay for their overall care as well.
I know before the show we were talking about some of the technology you've had in your office, and you've made a huge investment in that technology. So maybe just tell our listeners some of the things that you have, because most of them probably have been exposed to a lot of this.
Sure. Yeah. One of the things is that we have digital X-rays. Traditionally, dentists would take X-rays with a film packet, and then that would be developed in a developer and fixer. So some harsh chemicals, that aren't particularly kind to the environment. But the technique that we use is a digital processor. So we take the X-ray. It comes up on a computer screen. We can enlarge it. We can enhance it. I can email it to specialists or insurance companies or what have you. And it really helps in our diagnosing and picking up problems when they're small.
How's the radiation with that? Is it more or less than a regular X-ray? Because everyone's concerned about radiation.
It many times can be up to 90% less radiation depending on the situation. So it can be far less radiation than the traditional film.
I know you're also telling me that you have Zoom bleaching in your office. And, when I was in the mall the other day shopping for gifts, and there's a bleaching place in the mall, and there's people in there in white jackets that look like they're doctors, but I think they're just salespeople. So what's the difference? Why should someone go to a dental office for their bleaching versus, go to the mall?
Like I say, a white jacket does not necessarily a doctor make. So a lot of times they're really just salesmen that are doing the procedure in a mall setting. I think it's extremely important to have those types of procedures done in a supervised environment. Well,
those chemicals are harsh. I mean, they're bleaching your teeth. So are they using the same materials? Is something as harsh as what are they using compared to what you're using?
Usually the concentration is watered down. So in essence, what you're getting is really a far less dramatic result than you would have in our office. And in the wrong hands and unsupervised, certainly those chemicals can cause problems for patients. Now the active ingredient really is oxygen in the hydrogen peroxide, but if it's not handled properly, it can create problems for the patients. So really important to have those types of procedures, supervised by a dentist.
I wonder if people feel like when they go to the mall, there's no hassle. They just go right in, they get their teeth bleached, and they're out in 2 minutes. They're in Starbucks. But is it really any more hassle to have it done in an office like yours?
No, it's actually pretty easy to do in the office. The procedure itself takes about an hour. Patients are very happy with the results. They're really quite dramatic. And you have the supervision of a dental professional.
I would think also. There's that old saying, if all you have is a hammer, everything looks like a nail.
Right.
So if how many people can really self-diagnose exactly what they need? And I wonder, I've known people like this, that they've gone to the mall for a bleaching procedure, and they had it done, but it didn't give them ultimately what they wanted, because all they can do in the mall is a bleaching procedure, as where with your training, I would think you have the expertise to analyze it and really know what procedure would make them the happiest.
Absolutely. I had a patient that came in just the other day for the whitening procedure, and she was actually skeptical that we would not be able to deliver the results that she wanted, because she had the whitening in the mall. She had done some over-the-counter whitening, and she was just never happy with the results. And she came into my office really skeptical that we'd be able to deliver. And when we handed her the mirror, she was really, really excited about the results. And she said that if she had just come to us in the first place, ultimately it would have been a lot less expensive.
You mentioned beforehand that one of the biggest obstacles maybe people feel before they do the cosmetic dentistry is the cost. But what do people typically say after it's all done? A year later, 2 years later, do they regret having spent the money on improving their smile?
Not at all. The investment in cosmetic dentistry is really a long-term investment. And again, really the costs, I think a lot of times patients think they're going to be higher than they actually are.
So what do they typically say to you, the visit after you've put in their case, you see them 6 months later, what do they typically come back and say?
Almost without fail, they say, "Why did I wait so long? I should have had this done sooner." And they really can see some palpable changes in their quality of life.
Did you ever see, that show, the makeover shows on TV? They take this person, who used to be a shy librarian. No offense to our librarians that are listening, right. And then they remake them whole, and now they're singing on Broadway. Did you ever see people like that their personalities really modify?
Absolutely. They oftentimes sing show tunes on their way out of my practice. So they're, but we do. The results are really quite dramatic. And again, it really comes down to restoring their confidence, and patients being able to really express themselves again, and their true personalities really come out. And it's amazing how people are really stifled before they come in, and they're really happy with the results. And again, really the remark that we usually get is, "Why did I wait so long?" Yeah.
So for our listeners who want to get in touch with you, can you tell us where you're located? And how they can get in touch with you?
Sure. We're on Bayshore Road in Bayshore. It's number 245, and we are on the web. My website is www.bayshorecosmeticdentist.com. You can shoot us an email at drmcldds@aol. We're accessible.
Just give us that phone number again.
Sure. It's 631-665-6814.
And your website again?
It is www.bayshorecosmeticdentist.com.
And what do you say to that patient who's sitting home listening to the radio saying, should I, shouldn't I don't know, blah, blah, blah. What would you say to that person?
I would say that you would be one of the people that would say, why did I wait so long? So what are you waiting for?
There's no harm in coming in to find out what it's all about, right? That's
Absolutely.
for sure.
Absolutely. Come in. We do free consultations. You can certainly come in and chat, and we'd be happy to see you.
Well, that was great. John, thanks for being on the show. It was a great show. I really appreciate it. You're listening to Healthy Living Radio. I'm Dr. David Scharf. Tune in next Thursday. We'll see you then. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.